My name is Clayton Yates, and today I have here a researcher from the UK who is going to talk about some of the experiences of black men in the UK compared to black men in the US, as well as I have a community advocate as well, and that will ask questions of what can we learn from experiences in the UK that can be beneficial to men, black men in the US. So, can you tell us, Frank, introduce yourself and tell us a little bit about your findings?
Sure. So my name is Professor Frank Chinegwundoh. I'm a consultant urological surgeon based in London in the UK, and I've been interested in prostate cancer in black men for a great many years now. And I'm part of a group that have run many studies into this subject in the UK. And one of the things that interested us was that we knew from the American experience that black men were more likely to get prostate cancer. So we wanted to see if that was the same in the UK. And indeed, we were able to show in the UK that if you're black, you have a 2.5 to 3-fold excess risk of getting prostate cancer compared to if you're white. The other question was, is it biologically a different disease in a black man compared to the Americans? So the American data would suggest that prostate cancer is inherently more aggressive and biologically different if you're black, and that you're more likely to die from your prostate cancer. Our research in the UK differed somewhat. So we found in our UK studies that if you're black, you're likely to get prostate cancer 5 years earlier than your white British counterpart. But having said that, stage for stage, the outcome is the same. So our data from the UK doesn't suggest that it's biologically more aggressive if you're black compared to if you're white, except that you're likely to get prostate cancer 5 years earlier.
Okay.
Our research in the UK also looked at whether there were any differences in the delay to diagnosis, and if there were any differences in how long it took to get diagnosed, how long it took to get treated, and we also looked to see if there were any differences in treatments between the different groups. And in fact, what we found was that if you went to your family doctor with certain symptoms, you were referred to secondary care, that is the hospital services, the same speed as if you're black or if you're white. We also find that the diagnostic test that you received in terms of your prostate biopsy was the same, whether you're black or white or Asian for that matter, and there was no differences in delay. So the diagnosis of prostate cancer isn't delayed if you're black in the UK. And then when it comes to treatments of prostate cancer, you're as likely to get all the radical treatments, whether you're irrespective of whether you're white or black or Asian. So it's the same rate of radical prostatectomy, it's the same rate of radical radiotherapy, the same rate of active surveillance. So your race did not impact on the treatments that you received. Now, if we move on to the outcomes of having your prostate cancer, we didn't find any differences in the survival according to your ethnicity. So in other words, you did just as well stage for stage of prostate cancer, irrespective of whether you're white or black or Asian. Of course, the mortality is higher if you're black, but that just reflects the increased incidence. Because it's 2 to 3-fold increased risk of getting prostate cancer if you're black, that translates into the higher mortality. But it's important to appreciate that in the UK, the mortality is not disparate to the incidence. In other words, more men die from prostate cancer being black because more black men are getting prostate cancer. But our conclusion was that in an equal access environment, in the UK we have a national health service. You may call that a socialised medicine service, but everyone, irrespective of your socioeconomic status, has access to healthcare in an equitable fashion. And so we don't find any differences in the outcome according to your race.
Very, very interesting. Very, very interesting. Do you have any questions for...
Yeah. Dr. Frank, you've provided very useful information. By the way, my name is Zacch Olurunnina. I'm a prostate cancer community advocate here in the US. I'm just curious to know what, importance is your finding to, prostate cancer patients here in the US, black men, prostate cancer patient. What can they take away from your study?
Well, we feel in the UK that some of the disparities, at least in terms of outcome, are related more to the socioeconomic status of black men in the US, as opposed to there being biological differences. You know, that's our feeling. That's our impression. We have yet to show that prostate cancer is biologically more aggressive if you're black, which is what the US data suggests. So our take with reference to the black American is that the disparity in outcome we feel is a socioeconomic, and it's an access to healthcare issue. That's our take.
Okay.
Yeah.
Very good. Thank you.
Okay. And as a follow-up, and as a follow-up, and so just to make this clear for all men who may view this conversation that we're having, the study that you conducted over a large number of men, how many men are we talking about, and across and over what period of time?
Okay. So we looked. It was we looked retrospectively and we looked prospectively. We're talking about roughly about 2,100 men from well-described, well-demarcated geographical areas in London and also in Bristol. And we chose those particular areas because that's where you have the highest rates of black men residing. And bearing in mind that in the UK, it's probably 4% of the population are black in the UK. And also bearing in mind that 60% of all the black people live in London.
Good. Yeah.
So it's a very different demographic to the US, where black men are found throughout the whole of the US. In the UK, it's concentrated to those areas. Also, it's hard to say necessarily that what we find there is applicable to what pertains in the States, because the mass migration of black people into the UK really starts with the Windrush generation, so-called Windrush, where people came from the Caribbean in the 1950s and onwards. Of course, there have been black people in the UK for centuries and centuries, but in terms of large numbers, we're really talking about the 1950s onwards, which is very different to the black American experience, which goes back hundreds of years to the slave trade. And so there may be differences just according to the longevity that black people have been in the US compared to the UK. I suspect there's various what we would term epigenetic factors. In other words, it's not just your genetic makeup. Your environment may influence your genes, which may influence your likelihood of getting prostate cancer or the outcome of your prostate cancer disease. Right.
But your findings are all of that is mainly controlled for based on access to care.
Yes. And in fact, speaking to some of my American colleagues more recently, I'm led to believe that in the veterans system here, which is, I believe, an equal access setting, still there's disparities in outcome between black and white men, which I'm hard pressed to explain based on our UK experience. Right. So there's a lot of research to be done to try and tease out if there are differences, what is the cause for these differences.
Very impressive. So if you had to leave men, particularly men in the UK who may view this, as well as men in America that are black, what would be your something you would leave men with?
I think what I would like to leave men with is early diagnosis. If you can make the diagnosis of prostate cancer early, you'll do very, very well indeed. And so the only way currently that we're able to make an early diagnosis is by getting a PSA blood test. Right. With or without a digital rectal examination, but at least a PSA blood test. And the reason I mention that is because in the US there is a pushback against PSA testing.
Currently there is, yes.
And also in the UK, the government are not fully supportive of PSA testing. But what I say is that if you're black and you know that your risk of getting prostate cancer is 2 to 3-fold your white or your Asian counterparts, then you should take it upon yourself to get yourself PSA tested and not rely on external agencies to kind of, pull you towards getting PSA tested. So I would like to say to black men, despite all the kind of pushback against PSA, it's still the best test that we have. It's still the only way, as far as I can see, of arriving at a cancer diagnosis early. And if you diagnose your prostate cancer early, the treatments are very effective. And we have shown in the UK, in what's just been published, the PROTECT-T study, that if you find prostate cancer early, in fact, whether you have radiotherapy or you have radical prostatectomy or you have active surveillance, your 10-year survival is incredibly good. In fact, in this study just recently published from the UK, it showed that in a group of men with early prostate cancer, low risk prostate cancer, only 1% of them had died after 10 years, whether they had surgery or radiotherapy or active surveillance. So if you get prostate cancer early, the cure rate is extremely high.